It's a particular honor to be here with Chairman Baucus and Chairman Bingaman, and also with Barbara Easterling from the Association of Alliance for Retired Americans, and Stella Johnson, who is a real person actually in the donut hole to talk about this. I'm particularly glad to be here with Chairman Baucus because it was the Finance Committee that crafted this solution under his leadership, and Chairman Bingaman is the only senator to serve on both the Finance Committee and the Health Committee, and I had the pleasure, honor of serving with him when the health care bill was drafted. So these two gentlemen had an enormous amount of responsibility for getting this done, and I'm very grateful to be here with them. It is a great day. It is the beginning of a very important end, and that is the end of the donut hole that has bedeviled so many American seniors. One of the ways I reach out to voters in Rhode Island is through community dinners. We're a small enough state, you can actually take a significant portion of the voting population out for dinner. But at one of these community dinners in Woonsocket, a young man came to talk about his 90-year-old great-grandmother who lived in a walk-up tenement in Woonsocket, who'd been independent all of her life, who was fiercely proud, and who had gone recently on her usual walk to her friendly pharmacist to pick up the prescriptions that she needed for her health care issues, and at the window had been told that she had fallen into the donut hole. She was caught by surprise. She did not see it coming. She could not afford her medications. She had to walk away from that pharmacy window empty-handed and walk home to her apartment and start to consider whether she could remain independent after 90 years because of having fallen in the donut hole. That was the situation that Travis brought to my attention, and I have thought over and over again about what that walk home must have felt like for that proud 90-year-old woman. And that's why I've worked so hard to try to bring this to an end. 15,000 Rhode Islanders, but for this, would be falling into the donut hole without assistance from Medicaid or anywhere else, and having to face that moment at the pharmacy window that Travis's great-grandmother faced. So it is a wonderful deed that we do here today. It is a wonderful moment that we celebrate. And looking forward, one can hope that the time will come, responding to Chairman Bingaman's concerns about paying for this, that the unique and bizarre circumstance of the United States government being unable to negotiate with the pharmaceutical industry over price and therefore being overcharged by a massively profitable industry can be corrected, and that the funding available from that source can be brought to bear to accelerate the closing of the donut hole. But that should not take away from the very good start that this represents, and I'm really, again, proud of what Chairman Baucus and Chairman Bingaman have accomplished.